Welcome to this Bulletin brief, where we're reviewing RAS edition of the Bulletin of the American College of Surgeons. And I'm here with the editor of the RAS edition, which was in August of 2021, Dr. Meghana Kashyap, who is the chair of the Communications Committee of RAS this year. This edition really focused on advocacy, which is an incredibly important topic for surgeons to engage in. So Dr. Kashyap, can you tell us a little bit about how you chose advocacy as a topic this year?
Each year, the Bulletin allows RAS to come up with the topic, our communications committee. And in the recent past, we have done topics like diversity, equity, and inclusion. And this year, as we were thinking about what would be something timely to talk about and something that would be important for our membership as resident and associate members of ACS, we came up with the topic of the surgeon's role in healthcare policy. This stemmed a little bit from my own personal experience of attending the Leadership and Advocacy Summit and learning so much that we don't learn during our medical training. And, just wanting to know what resources are out there and what contributions we should be making as trainees, as newly graduated surgeons. And so from there, it kind of blossomed into the Bulletin.
I also find the Leadership and Advocacy Summit to be a truly remarkable conference. I learn something every year, and I find the lineup of speakers to be always really quite engaging and always providing new insights. As surgeons, of course, we have incredibly busy schedules, and in addition to all of our other duties, advocacy seems like one more thing that has to be done, something else on a kind of a checklist of activities for a day. Why do you find advocacy to be so important? And why is it so important in particular for surgeons?
I think it's for really every aspect of our careers. So when it comes to patient care, a lot of healthcare policy is made at levels that are above us on the, in the clinical workforce. And if you don't have a seat at that table, if you're not in those conversations about policy decisions, then it's adversely affecting the patients. You're not able to regain some of that control. From the professional aspect, I think that, again, compensation, things like that are directly related to policies that are made, again, at different levels. And so having that seat at the table, I think, is really important from both standpoints.
In your article, you also mentioned some barriers or challenges that surgeons have in participating in advocacy. Could you outline some of those challenges and how we can overcome them?
At the Advocacy Summit, we always talk about how you don't have to come to DC. It doesn't have to be meeting with members of Congress in DC, but you can locally be an advocate and meet with them. But meeting with them means that you have the time, and most of us want to be clinically excellent surgeons and taking care of our patients, and that keeps you busy on a daily basis. And so when do you find that time to go reach out to members of your local government? When do you find the time to attend meetings? It's not just meetings for advocacy. We have meetings that are just related to the job on a daily basis. And so I think that's the biggest struggle, is you not only have your clinical duties, you're in cases from 7:30 in the morning till 5 p.m. or later, and then you still have to carve out that time to attend meetings and do these things. And so I think, to me, that's the biggest barrier, and it just requires prioritization. And I think advocacy is something that we should be prioritizing more. Because, again, as we see with compensation and with decisions that are made about patient care on a more political level, it's very important that surgeons have a voice, and I think we need a stronger voice.
Absolutely. So how have you found ways to overcome that time barrier?
I don't know that I have actually yet. It's something that is on my kind of to-do list to do, but I think that simple measures like attending the Advocacy Summit and at least being aware of the conversation is important. I think in our articles, each committee has kind of outlined certain things that people can do to get involved. And some of those include, the ACS has the Surgeons Pack, just contributing to that as a simple measure. or participating in any of their advocacy efforts. But yeah, I think starting small with just where can you contribute, where can you allot maybe 30 minutes, an hour, just taking it step by step until you do have time to maybe make bigger efforts.
So I would like you to take us behind the curtain a little bit. How did you decide on the topics? So there are really 6 really phenomenal articles in that edition of the Bulletin. How did you decide on those topics? How did you pick the authors? And yeah, tell us a little bit about that.
So this edition is always where the Communications Committee chooses the topics or the overriding theme, and then each individual committee that we have then writes about something under that theme. And so it was actually left up to our standing committees. So we had our Communications Committee article, which was primarily focused on firearm injury prevention. We had the Education Committee's article, the Global Surgery Work Group, the Advocacy and Issues Committee, our Associate Fellow Committee, and the Membership Committee. And so, each one just came up with something. We tried to make it, this is a topic where you can end up having a lot of the same conversation, but I think each committee was able to kind of define their own area within healthcare policy about what they wanted to talk about. I think the Associate Fellow Committee did a really great job of kind of being a summarizing force in all of the opportunities that are out there for RAS members to get involved in advocacy. And so I would like to highlight that they do have a really excellent table in their article that kind of describes all the ways that one can get involved.
Sure. Well, you were able to bring a lot of folks together, and really it was a tremendous team effort. I mean, the number of authors and the number of different topics is a tremendous evidence of collaboration. Now, you're in a unique position, of course, as the chair of the Communications Committee, in the sense that you're able to help individuals become more involved. If someone wants to become involved in Communications Committee or maybe some other aspect of RAS, how could they do that?
So you reach out to rasnews@facs.org and join any of our standing committee meetings. It's Wednesdays every month at 9 p.m. Eastern, 8 p.m. Central. So the first week is the Communications Committee meeting. The second week is one of the other committees meetings, so on and so forth. And that's how I got started when I was an intern. I wanted to meet other residents around the country, and I just started joining in on these phone calls. I was very quiet initially until I met people in person at Clinical Congress, but slowly I started participating in the phone calls, and then, different projects come up and you start getting involved. And then through that, you get more and more involved. Through RAS to get involved with advocacy specifically, we do have the Advocacy and Issues Committee, and they are doing excellent work. And so I strongly suggest anyone interested in that to join that committee, join their phone calls, and get involved in their many projects. And then again, the Leadership and Advocacy Summit, we have scholarships for people to attend that when it is in person again. So far, this past year it's been virtual. So highly recommend people to attend that, and that's how you can also get involved with the Surgeons PAC.
Great. Certainly, one of my early involvements in advocacy that was really formative was the Leadership and Advocacy Summit. But let's say there's someone who, isn't able to make that commitment right now for whatever reason to come to DC and join us for that event. What one small thing could someone do who says, I'm a little short on time, but I think advocacy is incredibly important? What could they do that's really tangible and helpful right now to take the first maybe baby steps with regards to advocacy?
I think the first baby step is just gaining the knowledge and reading. And the ACS website has a lot of resources on things that you can read. And then from there, I would reach out to your local chapter of the ACS, because often the local chapters also have their own grassroots efforts going on. So those would be my first, if you don't have a lot of time, but you want to know how you can get involved in the future or learn a little bit more about what people are doing, I would go to the ACS website and then talk to the local chapter.
Fantastic. Well, you certainly have been quite involved in advocacy over time, and involvement through RAS as well as elsewhere. What one thing do you wish that you had known at the very beginning as you were starting out many years ago when you were an intern and as you were slowly getting involved?
I think it is just understanding how many decisions are not made by us as surgeons that do affect our practice. And so I think I just wish that I had more knowledge, and I still every day wish I had more knowledge. I listened to the Healthcare on the Hill, I think it's called. It's a podcast where they talk about different health policy discussions that are ongoing each day on the Hill. And so just, the awareness, I think I just had a lack of awareness coming into it. And over time, as you start thinking about your career and your practice, you start to learn that some of these things really matter and they really affect your patients and yourself. And so I think if I went back, talked to my intern self, I would have said to get involved sooner.
Well, you kind of really point to the fact that, we have a knowledge base about healthcare that many of the folks who are making these decisions really don't. And I think that is something that sometimes especially as a trainee, you often kind of underestimate how much you know, because you do know a lot about healthcare since you're really ingrained in the healthcare system. Let's say that someone does have the ability to go to the Leadership and Advocacy Summit and to meet with their legislators. What benefit or perspective did you find that you were able to bring when you met with legislators on the Hill?
Meeting with them was a little more eye-opening for me about what they do and how their day goes. We don't often realize the number of meetings that they attend and how little time they really have to have these meetings with us. And then the number of staff members with whom they work, and understanding that those are actually the key people. If you can get their staff to really take an interest and help you out, you can make some moves. And so I think that the benefit of going to DC and going to Capitol Hill is to meet those staff members and kind of develop communication connections where you can follow up with them and say, we were advocating for this or this policy, and here's more examples. What I learned is that they really want the examples of why these policies are relevant to you in your daily practice and to the patients and to the local community. They really want the stories because, they know the bill, they know the policy, they want to know why it matters.
Sure. No, I think putting that kind of human face to the issues, I think is a perspective that we bring, as you were alluding to, that's really critical, I think, to have a story to go, as you said, to go along with it. Yeah. Well, this is a kind of a unique year because we've had 2 RAS editions of the Bulletin, which I know the previous one had been delayed a little bit. So congratulations yet again on another terrific Bulletin edition sponsored by RAS. Any kind of final comments that you want to mention about the Bulletin or about advocacy or a topic that we haven't covered?
I just want to thank all of the RAS members who participated in writing these articles. It was by no means my effort alone, and the exec board oversaw everything, and Allison Powers has been a great help. So I just want to thank all of them for everything that they did to contribute to this.
Well, thank you again, Dr. Kashyap, and I'll echo your comment about Allison. She's the glue that holds RAS and YFA together, certainly. Yeah. Well, great. Well, thank you again for your time, and congratulations.
Thank you.